All right, so another very important part of being an amputee is not just managing your volume properly, but also making sure that you're inspecting your skin regularly. Okay, so we've been wearing this prosthesis for a little while, and so what we will do, what we're looking for is when we take the prosthesis off, we're looking for redness, any kind of blistering, breaks in the skin, so on and so forth. Now, there will be a little bit of redness, that's normal, but that redness should dissipate within a few minutes. If an hour transpires and you still have an area of redness or maybe it's even painful to touch or there's some visible signs of breakdown, that's usually a warning sign. In some cases, it's self-inflicted in the sense that the patient wasn't managing their volume properly and that they developed it, but sometimes it can be a problem with the socket itself. We're talking about fitting a limb with a lot of bony prominences, a lot of bony areas that we want to make sure there's not a lot of room between those and the socket. So we want to make sure we protect those areas, and every once in a while we need to add a little bit of room within the socket by either grinding out some material or in some cases heating that material to give that those bones a little bit of room. Most of the skin trauma that you're going to more than likely see is going to occur somewhere between the halfway point, the midline of the limb, and forward. A lot of the bony anatomy is all up here in the front. On occasion we see some things here in the back, but there's a lot of good soft tissue back there that cushions the limb. Most of the things are over the shin bone, the tibia, the end of the shin bone, or the distal tibia that's very prominent. Sometimes the fibula head, there's some bones over here on this side of the limb. But ultimately, most of the skin trauma that we tend to see that's socket related is going to be over a bony area. Okay? Sometimes rashes or blisters and things at the very, very bottom can be related to not putting the liner on properly, some sort of a fungal infection or just heat rashes, those type of things. But anything that doesn't look like it should, and anything red or any wounds could be a warning sign, and we take those very seriously. But we rely on the amputee to let us know if there's a problem so that we can address it quickly, because we don't want to leave that unaddressed for fear of running a higher risk of infection. We don't want that either. So make sure you're checking your skin regularly, especially as a new amputee. You'd want to check it several times a day. Even as an experienced amputee, if you experience a day that you're more active than you normally would be, of course you make sure you have lots of socks handy, but it doesn't hurt to take your prosthesis off and just give it a good once over to make sure everything's okay. That'll save you a lot of pain and suffering possibly in the long run. If you can't see the entire limb, just take a hand mirror or something sometimes and you can look around to make sure that you can cover all the areas that you're trying to look at. And again, if you happen to, make sure you're checking your other foot, that doesn't hurt either, because we want to protect that foot as well.